Hello, my name is Jesus Verdun, and I'm an e-health expert at Fundació Salut Social, which is an organization under the Catalan Health Ministry for the promotion of digital transformation of health and social care sector. So first of all, I would like to thank the organization team for the opportunity to participate in this Congress. My presentation will be focused on the actions taken by healthcare authorities in Catalonia to facilitate the implementation of remote consultation tools by developing visual guidelines to incorporate such tools in daily practice. So, Catalonia has a population of 7.5 million inhabitants, with a high expectancy of birth and almost 20% of population over 65. Our healthcare system is based on a multi-provider schema in which public and contracted providers offers both public services to the population under a universal, tax-funded and free access model. In terms of health information systems, the digital health ecosystem has allowed a rapid adaptation to the pandemic situation. As you can see, the transformation we have experienced in the last 2 years because of the pandemic has changed the current model for service provision. All stakeholders in the healthcare sector had to quickly adapt to a situation of saturation of centers and limited mobility and accessibility by the population. So we can see in the graph that between March and April 2020, more than 50% of face-to-face attention was reduced in health centers. In exchange, phone calls to help number increased by 5. After the most critical weeks, activity has slowly been recovered, although remote channels have remained an essential asset of the new situation. That is why e-consultation, which is a synchronous messaging system, is growing with a sustained pace and is rapidly becoming an essential channel for professionals and citizens. Here we have to say that major drivers to this change have been, first, the capacity of professionals to adapt to a new model of care that combines face-to-face with remote consultation. And second, the capacity of the system to quickly deploy technological tools. Having said that, it is important to mention that transformation cannot be addressed only from a technological perspective. Sustainable change relies on the capacity of our professionals and citizens to include such new tools into their daily practice. So, which have been the major actions taken to rapidly deploy such remote consultation tools? So by mid-2020, a rapid implementation of remote consultation was required in all the region. So some quick key facilitators had to be produced. In order to give an answer to that, the Latitude model, which defines a strategy for non-face-to-face attention, allowed us to make up a multidisciplinary team formed by practitioners, scholars, and scientific society. The aim of this group was to develop implementation guidelines in a very visual way throughout the participatory co-design process. So the objective was not only to create prioritization requirements for face-to-face and remote care, that is, how can professionals choose when a remote tool is more appropriate than a face-to-face. So which are the requirements or the criteria to prioritize between face-to-face and remote care. Second, which are the requirements related to non-face-to-face channels. And finally, how can we create graphic materials to help professionals to implement such tools on a day-to-day basis. So it is important to stress out the need to involve professionals during a critical change on a day-to-day practice, as it is the deployment of remote consultation tools. That is why we included more than 50 professionals from healthcare sector in Catalonia involved in the activities performed. These include CatSalut, the Catalan Health Service, including representatives from Care Management Department, Citizenship Innovation and Marketing, and the eSalut Office. We included also healthcare providers, not only from primary care, but also from specialized care. We included also the scientific society, as members of the Medical College of Barcelona also took part in the activities. Also data protection experts. Here we have to stress out the importance that data protection has on these new tools. So data protection delegates, lawyers, legal advisors, and the legal service from healthcare provider unions also took place. Last but not least, e-health experts was helping the group in order to create all these group dynamics and to reach consensus on which was the content required in order to produce these clinical and visual guidelines. So the work conducted between May and June 2020 was divided in 3 steps. First, there was an evidence collection, search of empirical and qualitative studies and grey literature. After that, all the data collected was processed, and there was a consolidation of evidence which was broken down into 6 areas: use case scenarios, organization and expertise, tools and requirements, good practices, legal aspects and ethics, and finally a checklist. With all this process, guidelines were produced and were validated through an iterative process of reviewing the versions by all the group that took part on those activities. So the results from this exercise has been a set of guidelines, both for primary care and specialist care, detailing first the channels, so which tools are we using and how to use them. Also organizational aspects, so which reorganization is needed to deploy such tools. Data protection, like which data protection privacy elements are needed to appropriate use these tools on a clinical practice. With this regard, we wanted both the professionals and citizens to be comfortable on using those tools. Also, best practice were shared. So which are the best practices that can make the best of using those tools? That is, how to guarantee quality, accessibility, and sustainability of services. So as you can see here, we make a zoom in on some of the guidelines produced. Channels and examples of use of remote tools were collected. So making sure that professionals identify those situations in their daily practice. So both for a consultation, for a phone call, for video consultation, we describe the criteria and the scenarios in which such tools could be used. It is also important to reflect that this is not an imposition, but guidelines were described more on a recommendation way, providing tools and examples for professionals on when to choose a remote consultation tool over a face-to-face encounter. In terms of organizational aspects, some of them were also highlighted. For example, it is very important to guarantee that there is an integration between the agenda of professionals to include remote activity. Or is it also important to create a protocol to select which patients or in which situations a remote consultation is appropriate. So some of the aspects to consider were included: how to define this circuit in which we identify a situation in which a remote consultation can be performed. Are we sure that the patient is comfortable with it? Can we reach an agreement between the professional and the patient that this is the most appropriate channel to be used, guaranteeing also that we could achieve a resolution of the case by using this remote tool rather than adding an additional face-to-face encounter in the future. So some protocols, some change management aspects were included, and also some communication and training aspects were included in the guidelines. Also, some good practices were identified, as I said, related to data protection and privacy, making sure that all regulation is fulfilled. So the citizen must receive information about how this channel works, which is the treatment of the personal data, and this is very important. There must always have to be a consent, at least verbal, between the citizen and the professional that this channel is appropriate to be used on a specific situation. So we need to inform the patient, we need to inform also professionals on which is the current regulation that can apply to such tools, and this also makes both professionals and citizens more comfortable on the use of such tools. Finally, regarding best practices, some of the essential aspects were identified that can happen before, during, and after the visit. This was to help professionals to conduct remote tools in an appropriate way for their clinical practice. Not only for professionals, but also for patients' comfort and privacy. So before the visit, during the visit, after the visit, what a professional is recommended to do to inform the patient that the encounter can happen on a remote way, that this will be a useful and appropriate way to make such encounter, and also to give, for example, the option to the patient to make a face-to-face if a remote tool, if we kind of suspect that the remote consultation tool in this scenario cannot work. So to sum up, after a system overburden related to the COVID situation, there was a required and an urgent need to rapidly deploy remote tools, and to address that, a facilitator team was configured with representative, and this is very important, to include all representatives from the healthcare sector, as I said, to reach consensus both in primary care and specialist care, and most of all to create visual guidelines that will help professionals to include such tool in their daily practice, guaranteeing quality of the services, accessibility and sustainability, not only for the professional and the healthcare system, but also for the citizenship. So this was all from my side. Thank you very much for your attention.